Okay, we're continuing with the book Prevent and Reverse Kidney Disease by me, Pete Rogers. We're on page 57 if you're following along with the books, the chapter on kidney stones. So the most important thing to know about kidney stones is eating meat is the main risk factor for kidney stones. So you want to avoid all animal foods because animal protein is different than plant protein. It's more acidic, and the kidneys end up having to buffer the pH. And part of what they do is they co-excrete hydrogen protons with calcium. So you end up with increased calcium in the urine. That's called calciuria. And when you get higher and higher amounts of calcium in the urine, you have an increased tendency it's going to precipitate to form a stone. So that's one of the reasons why you want to be well hydrated, because you're going to have more urinary volume going through, like this beautiful painting here, Holy Cross Mountain and the stream by Edward Moran. You'll have the flow going past it, and that will help clear out the precipitating kidney. It's also recommended not to drink caffeine, because that increases your calciuria. That can make it worse. You don't want to be dehydrated. High sodium chloride diets also make it worse. Let's see here. Here's a nice river landscape by Peter Monk Munstead. So I was just sort of showing these with the idea of good hydration, good water flow going through your body is good. If you're going to drink a lot of water, though, you got to make sure the water is safe to drink. It's got adequate osmolarity. Like, you can't just drink that much distilled water or that much reverse osmosis water. Some people would squeeze a lemon in there, or you can, drink water after eating. That's what I typically do. I've eaten and then I'll drink a little water. You got to figure out with your own routine, but just be careful. If you drink all this water that's over-filtered, distilled or reverse osmosis, you can get headaches from that, from hypoosmolality, because your blood's about 285 to 300 osmolality. And TDS, total dissolved solids, is not the same thing as osmolality, but for our purposes, it's close enough. It's a number. TDS is total dissolved solids, the number of particles per cubic centimeter. And with RO, it's only about 5 to 10. With distilled, it's 0 to 2. So that's too few, and compared with tap water is going to have an osmolality in the ballpark of like 200 to 400, something like that. So your body handles that just fine. But with RO, it's a bigger deal. Carbon filter is not going to go as far. That's going to be easier to drink, but you don't clean up everything you want to in carbon filter. It's not going to get all the fluoride out, for example. A lot of plant foods are really wet. Lettuce is about 95% water, oranges 87% water, blueberries 85% water, potatoes about 75% water, bananas about 70% water. So it's good to eat a lot of fruits and vegetables. They're pretty well hydrated. Oatmeal is a really hydrated food. Like, I would like oatmeal for breakfast or for lunch because it really hydrates you, but I don't like it for dinner because it's so wet you'll have to wake up to go to the bathroom at night. Like I said, number one risk factor is eating meat because of the animal protein. We just talked about it. The acidity causes some calcium leaching from the bones, some from the muscles. Some persons also believe from some studies that they think it's also causing increased calcium absorption from the gut. A small stone will pass out in the urine typically, like if it's 7 millimeters or less, but 7 millimeters or more, bigger than 7 millimeters, out of a tendency to get stuck in the ureter, like distal ureter is a common location, the UVJ, ureterovesical junction, the junction of the ureter with the bladder. Bigger stones will often get stuck more proximally. A really giant stone is called a staghorn stone in the kidney. Obstruction of the ureter is called hydronephrosis, and it's a big deal because, piss and pus must come out, my old attendings used to say, and the point being is, if you have stasis of the urine, it'll have a tendency to get infected, can spread retrograde into the kidney. That's called pyelonephritis. That can spread into the blood and make the patient pretty sick. So if there's hydronephrosis due to obstruction by a stone, I put in hundreds of nephrostomy tubes, kidney drainage tubes for those, because you have to drain those pretty quick or they'll have a tendency to get infected. Let's see. Once you form one stone, you're going to have a tendency to have more. The other thing is lots of patients who have kidney stones, because I've seen thousands of follow-up ultrasounds and CAT scans on patients with kidney stones. The vast majority of them have a fatty liver. So they're pre-diabetes. The same diet that causes diabetes causes kidney stones. High-fat diets, animal food diets. Okay. So excessive dietary sodium also can cause calciuria. Caffeine will contribute to it. Being stressed out from sleep deprivation, corticosteroid medications, they'll have a similar effect. They'll increase calciuria. Excessive dietary vitamin D, you want to be careful about that. I think they totally overhype this vitamin D deficiency stuff to sell more of it. Industrial fructose, high fructose corn syrup in processed food because it leads to increased risk of uric acid elevation in the blood. You can get uric acid stones less commonly. Some people recommend decreased dietary oxalates. The oxalates from low-fat plant foods are less absorbed from the gut. Let's see. And we talked about the fatty liver. Okay, so that's it for the topic of kidney stones today. And you really want to avoid them and not have a recurrent episode, because people who have lots of kidney stones, they end up going for a lot of painful procedures, and every time you put a drainage tube in the kidney, you damage the kidney a little bit. You just chip away at its kidney function. One tube one time is no big deal, but some of these patients, they keep coming back and back, and like I would have to put a percutaneous nephrostomy in the kidney, and then urologists, if they have to come from above, they would dilate the tract to about 1 centimeter in diameter, 30 French, for a percutaneous nephrolithotomy. Pretty big tube, pretty big hole in the kidney. So you'd be better off avoiding that if you could. So anyways, I hope you found that helpful.